that a leaf hat?
Maybe.
Okay, that's going to be a problem. Ready?
Yeah.
Okay. Well, good afternoon, everyone. Thanks for joining us. It's always a pleasure to be here with Dr. Morrison and Marian, who will have the regular updates from Chief Public Health Office and Health PEI for you shortly. I just want to again say that I continue to be impressed with the resilience and passion that Islanders have. The optimism that I'm hearing from business leaders for nonprofit organizations and from community groups across the island is inspiring. These individuals are working hard to find new ways to manufacture or sell their products, to offer their services in new ways, and to adapt to this difficult time we find ourselves in. And we know very much that these are difficult and challenging times, and we know that people have a lot of questions. I know also that there is a tremendous amount of information being released each and every day, and I know it can be difficult to follow it all. But for businesses and organizations specifically who are working to adapt, I wanted to give a little insight into what we have boiled down to really 4 initial steps that you should take as you move forward under the Renew PEI Together plan. As a first step, each business should review the plan that was released last week. This plan does outline the phases of the recovery stage and identifies when certain businesses and organizations are slated to have the ability to reopen under new conditions. Secondly, they should review the principles and guidelines on the Renew PEI website. While these guidelines are broad in nature and cover such things as hand washing, disinfecting high-touch surfaces, or reducing payments methods to credit and debit, also ensuring the safety and well-being of employees in the workplace. These are critical to all phases of the Renew PEI plan and may require businesses to adapt from their pre-COVID operating practices. So for specific sectors and industries, the CPHO will be developing sector-specific guidelines. They've done a lot of them already, and they will continue in the days ahead. And they will be publishing them as they are developed as soon as possible. Number 3, businesses should connect with their industry associations. These associations can work collaboratively with their members to establish common practices and procedures and put everyone in the industry on an even playing field and provide consistency for employees, employers, and customers. Industry associations should work with CPHO to develop these industry-specific guidelines, and we will publish them on our website once they're complete and approved for assisting individual businesses with their operations. Now, for those businesses and organizations who may not have an industry association, I would encourage you to reach out to your local Chamber of Commerce and ask them to help connect you with other like-minded operations. I would say that in conversations that I have been having and our office have been having with business operators and their representatives, we have been asked to put in place liaison services for individual businesses or organizations to make it just a little bit easier to navigate the process with public health and to find answers to the many questions you may have. And that process is underway and should be in place very, very soon. Finally, each organization will need to complete an operational plan outlining how their business, service, or organization is prepared for COVID-19. The CPHO has developed a template, and it's available on the website, that provides guidance for developing these plans, and these plans should be created before providing services. Now, let me just be clear. Heather's been clear the last few days, but let me be clear again, that these plans do not need to be submitted to the Environmental Health Office. However, the Environmental Health Office will be doing inspections for compliance, and operational templates will need to be available on site for the review when that inspection were to take place. So once you have completed the operational plan and the Renew PEI Together plan allows you to open, you should be ready to start operating again. Now, I know, as I said, this is a lot of information, but we will be providing these simplified steps and procedures to industry associations and chambers of commerce later today so they can be distributed more broadly to the membership and to businesses and organizations across the province. Now, before I leave this topic, I would just reiterate that these businesses and organizations need to keep both customers and employees' safety top of mind. Without healthy and safe employees, businesses can't operate, so we need to protect them as much as we are in the process protecting our customers and clients. And I would just add, before I turn it over to Dr. Morrison, that over the last number of weeks, Minister Aylward and staff from his department have been meeting with private operators of healthcare facilities and hearing directly from them on how government can assist in protecting our most vulnerable islanders during COVID-19. Today, I'm pleased to announce that our government has approved increased funding to assist private healthcare facilities, including long-term care and community care facilities, for their additional costs related to personal protective equipment, as well as to assist with increased staffing costs in order to keep their residents and staff safe. This fund will provide $300,000 per month to community care facilities and a further $290,000 per month for long-term care facilities. Plus, there will be another $130,000 to provide additional supports for dementia patients entering long-term care. And this will continue until such time as we feel we've been through this difficult time that is COVID-19. We know, after watching our sister provinces, that these homes for our seniors and our vulnerable populations are at great risk if an outbreak occurs. We've moved quickly to restrict visitation, and now we need to work towards making sure all the efforts we need to take to minimize the chance of an outbreak here in Prince Edward Island. This extra funding will assist so that our private partners will be doing the job we ask them to do, and they will be supported in the process with the overarching goal of keeping our loved ones safe. And I'd also add just finally that we will be in a position tomorrow, providing the final approval of the federal government, to announce our support program for low-income workers. We're just awaiting for the final go-ahead from the federal government, but should be in a position to announce that tomorrow. And I know many islanders are eager to hear that announcement and to get those funds flowing. So with that, Dr. Morrison, I'll turn it over to you.
Thank you, Premier. Good afternoon. Islanders have so much for which to be thankful, and we have not only flattened the curve, we actually avoided having a curve related to this pandemic in the last number of weeks, and we've been spared the horrific impacts of this pandemic that we've seen elsewhere. There are no new cases to announce of COVID-19 in Prince Edward Island today. 26 of our 27 cases are considered recovered. It is, speaking of long-term care facilities, it is important to note that outbreaks in long-term care and seniors' homes are responsible for 82% of the deaths in this country. We have, as we mentioned different times, we're always updating our testing criteria and our groups for whom we want to test, and our updated testing document has been added to the website, but we're meeting again today to look at it. And some of the groups that have been added to the list, and I'm not sure we have mentioned this, it would be staff at the QEH Microbiology Lab, long-term care staff who work at more than one healthcare site. And on that note, starting next week, I've been asked to mention that long-term care staff will only be working at one facility, and that is both through the department and Health PEI have been working on that, and that would start next week. More is emerging every day on where and when the virus actually started. Some of you may have seen some of the media reports on that as well, and the studies that have come out. We continue to learn about this virus, and we've said that different times here. Also, some reports of increasing Kawasaki disease noted in some children across North America related to COVID-19. We continue to have discussions about blood tests for immunity, and our whole country is looking at this and waiting for approval of those types of tests. I was asked on Monday about some enforcement numbers, and we've had a number close to 250 complaints into the Chief Public Health Office, Crime Stoppers, and into police. We've issued 93 warnings, 16 charges, and 232 residences were attended. The approach we are taking with Renew PEI Together includes various phases. Carefully and cautiously easing these public health restrictions in PEI. It's a stepwise approach that is being used right across the country. There may be some variations you'll see from province to province, but the approach is similar in that we are trying to do that in phases and stages, and every province having slight variations based on really how COVID-19 is affecting or could affect their province in the future. But right across the board, the health and safety of our population is the number one priority. But there's no guidebook on how we go forward and deal with COVID-19 and the recovery of this first phase of COVID-19. It's a first for everyone, and we're all, I know, sitting here and everyone who's watching we're all learning to navigate this situation the best way we can. Many factors go into the planning of phases for our phase approach and other places. Public health risk, and which is really a population level risk as opposed to individual risk, and that's what public health is about. Looking at jurisdictional benchmarks and consistency within and between phases, and medical need as well. So a number of factors go into that, into the planning of these phases. We do need to get through this together, and the efforts that we've all put in by each and every islander have been tremendous to date, and I know will continue. The Premier mentioned a number of particulars of each phase of Renew PEI Together and how important working with businesses, organizations, communities, and islanders as we reopen in an active and safe way. A reminder that if a business or organization is not ready or comfortable to reopen when certain dates come, they also may choose to wait or look at how they operate differently. The operational template that is available online, as the Premier mentioned, it's important to have available on follow-up inspections. I've been asked different times this week about a colleague who is from Prince Edward Island, Dr. Bonnie Henry, and I will use some of the language she's used as well, that smaller is better and outside is safer. And I think that is reflected in these early phases of our approach here to PEI. And she's been saying the same thing for British Columbia. So as we increase our network of social interactions, we do want to think, though, about how we can include those who are more vulnerable and without putting them at risk. And I've been asked before, we're all getting questions about that. And so we are thinking about it and trying to come up with an approach that we are all comfortable with in terms of being close in person to people who may be considered more vulnerable. And how do we do that safely? I've heard the concerns from many members of the hairdressing industry in this province. I have read every one of the emails, and I've heard you. But I've also spoken to the head of your association last evening, and I know our office has been working on guidance documents with your association over the last week. And that guidance is based on input from your own organization and what has been going on across the country. And for those stylists who have operational plans in place and are comfortable to go ahead, certainly may do so after May 22nd. But I also would support those who are not able to have operational plans in place and who are not comfortable that they may want to work or open at a later date. It is perhaps relevant to mention that there are other provinces who are also have opened or are opening at the middle to the end of the month. We continue to receive requests for those who are wanting to come to PEI, especially those who have seasonal residences here. At this point in time, I think it's important to mention that this will be reevaluated in the coming weeks, but we non-residents are asked to delay coming to Prince Edward Island, but I appreciate that many are anxious to make their plans. The advice we're giving and the direction we're giving in terms of non-residents is very much in line with what Nova Scotia and New Brunswick are saying. We're also wanting to look at family members who want to come to PEI. For instance, someone who may want to come here to visit their parents like they always do every summer. So how do we look at this going forward, yet knowing how important our border measures are going to be to restrict the entrance of or increase the risk of COVID-19 coming into Prince Edward Island? We certainly we're not responsible for this global pandemic, but we have been responsible for how well we have done in the last number of weeks of getting through this pandemic. And we will continue to be part of the next months ahead and how we do in the next months ahead. This summer, as we look forward, and I think with the nicer weather and starting off in May, we look to summer. We want to have low numbers of cases as we go forward in Prince Edward Island. We want to be able to identify them quickly, do contact tracing. We want to make sure that our businesses, grocery stores, work environments, and play environments are safe, but that we're using them and working. And going back to Dr. Henry, she said, think of few faces and big spaces. And I think we'll need to do that this summer as we go forward. This summer will be closer to home for us. I know one of the sayings was, come play on our island, but I think it will have to be let's stay on our island for us this summer. So it is a slow and steady process. We will get there together. And I think I've ended the last number of briefings by asking for patience and kindness, and I will continue to do that today. Thank you very much. OK, peut-être quelques mots en français. Juste, à Lille, on n'a aucun changement de numéro de cas. 26 des 27 cas sont recouverts. On a aujourd'hui une mise à jour du document sur le test sur notre site web et les précisions vont inclure les nouveaux groupes de gens qui auront besoin de se faire tester et puis on continue de rencontrer pour discuter ces groupes. Mais pour l'instant, le personnel du labo de microbiologie à l'hôpital ici à Queen Elizabeth et les travailleurs au foyer de soins qui travaillent plus d'un site. Mais on annonce aujourd'hui que commençant lundi prochain, les personnes qui travaillent un site. Pour les travailleurs au foyer de soins, ils vont seulement travailler à un site et pas plusieurs sites. L'approche du plan provincial a plusieurs phases qui permettront un relâchement de certaines restrictions. Et c'est une approche partagée à travers le pays. Et chaque province a leur propre plan et c'est propre à leur situation, mais en majorité, on suit un plan des pas, un pas à la fois. Mais la priorité pour nous tout, peu importe où nous habitons, c'est la santé et la sécurité de nos populations. Il n'y a pas de manuel pour cette pandémie, c'est un premier pour nous tous. On va continuer à faire de notre mieux. Le succès de notre plan provincial nous appartient tous. On a besoin de l'effort collectif des insulaires. Et je sais, il y a plusieurs inquiétudes de la part des coiffeurs, mais je vais me répéter et dire que si vous n'êtes pas à l'avis d'ouvrir à la phase 2, vous pouvez repousser votre date d'ouverture. C'est ce que font d'autres provinces, donc sentez-vous à l'aise de faire ça aussi. Et nous continuons de recevoir beaucoup de demandes des visiteurs que nous recevons chaque année, normalement. Mais ce n'est pas une année normale. Si vous n'êtes pas résident de notre province, je vous demande de ne pas planifier de voyage ici, mais cette date, après le 1er juin, cette date sera réévaluée. Je tiens à remercier les entreprises et les insulaires qui modifient leur façon de vivre et d'opérer. Vous avez au cœur la santé de notre province et donc merci. Les mesures sanitaires que nous avons en place resteront encore longtemps dans notre quotidien. Petit à petit, on va y arriver ensemble. Et comme je dis chaque jour, ça va bien aller. Merci.
Good afternoon, everyone. I'll start by saying Prince Edward Island is a pretty good place to be if we have to stay here. At Health PEI, we're carefully monitoring the COVID-19 situation on PEI and remain ready to care for any potential future cases in our community or in our hospitals. We're also continuing to implement plans to limit the impact of this virus in our health system and with Islanders. At this time, the focus remains on ensuring the most vulnerable Islanders, such as those living in our long-term care homes, are protected, and we have the best possible plans in place to care for residents and stop any spread should that occur in these homes. We're moving forward as well with increasing some services with a careful and gradual reinstatement of procedures such as surgeries and elective surgeries this week. The services are being offered so that patients who need service now can get them, but at the same time, we maintain our capacity in hospitals for any potential outbreak or new waves of this disease. The reinstatement of services is being planned by a dedicated team that includes both administrative and clinical leadership from across the health system. This approach will take time, and we need to be prepared to maintain our capacity, not just over the coming weeks, but months. We also need our operational plans that the Premier and Dr. Morrison have been speaking about for physical distancing and managing the safe practices in these services as we ramp them up again. As Islanders know, we've all learned a lot during this pandemic so far, and there will be more lessons to come. As we restart some services, we're also looking closely at some of the quickly established innovations such as virtual care, the cough and fever clinics that could and should play a part in our health system in an ongoing way. I want to reiterate as well that our hospitals and healthcare facilities are safe for patients. If you need care, you can feel confident that our facilities are prepared. We have protocols and standards in place by our infection prevention and control team to ensure your safety. It is a priority, and we want people to feel safe when they have to come to a health center or hospital. It's important for you to take care of your health needs before they become bigger issues. If you are sick or have a health concern, please contact your family doctor or nurse practitioner or go to a walk-in clinic. A list of walk-in clinics and times is available on our Health PEI website. Call 911 or go to an emergency department when you do have an emergency, such as discomfort or tightness in your chest, unusual shortness of breath, severe abdominal pain, and other significant health issues. While COVID-19 is a major health concern for Islanders, Health PEI is here to look after all of your health care needs, and your well-being is important to us. The cough and fever clinics and drive-through testing clinics are still available in Charlottetown and Summerside 7 days a week. And yesterday we saw 62 patients in Charlottetown and 11 in Summerside. If you have symptoms such as a new cough, fever, sore throat, runny nose, or unexplained fatigue, please contact your family doctor or nurse practitioner's office or call 811 to arrange an appointment at the clinics. I want to just say thank you once again to all Islanders who are helping in this response, whether it's by physical distancing or providing essential services. We appreciate your continued patience and support as we move forward to reintroduce health services over the coming months and make our plans in a careful way. Thank you.
Thank you very much, Marian. And just before we go to the media, I would just again like to say thanks to both Marian and Heather for their incredible work, and also the sea of people who help behind the scenes who you don't get to see on here. But there is a tremendous amount of people who work hard and work long days to help both of these individuals provide the updates that they do today. So to all of them, thank you as well. So with that, we will go to some questions from our friends in the media.
Nicole Williams, CBC.
Hello, everyone. I believe this question would be for Dr. Morrison, potentially Marian Dowling, but I think it's for Dr. Morrison. You said that services reopening in this first phase, like optometrists, naturopaths, anyone reopening in this first phase would have access or be able to apply for PPE from the provincial stockpile. But we've heard from some who are saying they're not sure how it works, who gets what, how much they'll receive, and when. I'm wondering if you can clarify just how much is available for services and how that all works.
Hi, Nicole, and Marian may be able to add to this too. I think if people are having questions, and I think it's really good to highlight that we probably need to make sure that that's clear. Some businesses and organizations would already, pre-COVID, you have some personal protective equipment that they may be buying and purchasing before this all started. So certainly those who had that available would be encouraged to use their supply chain that they normally would do or had used previously. Those that don't have that same kind of access to the supply, there is a process where people can indicate, and I think I've mentioned that here, and where they can indicate what they might need. And then there's a table of people who are trying to make sure that they distribute it according to who might require it the most. Certainly Health PI being medical personal protective equipment being very key, and then but they're recognizing that there are other groups that also need access to personal protective equipment. So we can certainly send you some of the details of who Nicole, that you could use to get to the public or not so much for the public, but for certain organizations if they need to. And we can provide that and follow up. And I believe some of that actually may have been provided in a written question, but it may not have gone to you yet. So we're happy to do that.
Thank you. And I'm wondering if you could just be specific about exactly how much PPE is available for services if they want to apply for some, and who pays for that? Like, are services expected to pay for the PPE that they get, or is that the province?
Yeah, sure.
I can try and answer that one, Nicole. I feel like I need to say it's Marian speaking, but you can see me, I just can't see you. I can find the actual numbers for you that are available in the provincial government stock, but I think it really goes to the businesses or community members needing to have their operational plan and thinking carefully about what do they require. We've certainly learned a lot, even in the health system, in our response, where the priority should be for personal protective equipment and what's appropriate based on your other practices or other measures that you can put in place, like distancing or not touching. And you don't necessarily need gloves if you can wash your hands frequently and have those supplies. So it's really important for groups to pay close attention to all those components of their plan as they're looking to ramp up of maintaining the safety. So the personal protective equipment, as I've been talking over the last number of weeks, is challenging to purchase. And so, as Dr. Morrison said, those areas that need to get it on their own and would have purchased it in previous times, just as Health PEI is. We are using our normal vendors and reaching out to others as well. But we need to be careful about how we use it and make sure it is going in the most appropriate place, but then providing access to those who have it. And my understanding is that just as Health PEI would if we were purchasing things from the federal government and others, as we are purchasing those and we are paying for those items. It's just another avenue, and this provincial stock is another one of our vendors that we're purchasing from. So my understanding is that business would be expected to purchase that equipment for their use.
Thanks so much. And
You're
I
welcome.
can always recognize your voice anyway, so don't worry.
Thanks.
Louise Martin, CBC.
Oh, good afternoon, everyone. The first part of the question, I think, will be directed more towards the Premier. This is a heads up to the camera moving. So Premier King, you probably saw the press release today from the official opposition about hosting virtual QP until the House reconvenes for regular sitting. That's starting today. And they also mentioned there a brief emergency session scheduled for May 22nd. So I'm hoping you can confirm that date of May 22nd, and then from a public health perspective, how that will work exactly under the public health measures and still being physically distant.
Well, thank you, Louise, for the question. And let me just say off the top, you shouldn't assume anything about me reading information from anybody other than what I deal with on a daily basis. So I didn't see the actual news release. We have been working, we've had 2 meetings last week, the party leaders working towards a May 22nd tentative sitting with the hopes of getting everybody in there to have a one-day sitting to talk about the COVID expenses that we've had so far, and also to pass some emergency legislation that we need to get through, and to approve some of these officers who have been selected for positions but require 2/3 vote of the Legislative Assembly. So I know in part of those meetings we also had asked the legislature through the clerk to explore how we would go about having a virtual sitting, knowing that we could be in a position in the fall that we're right back into this. So other than that, I don't know the other details of the news release, but so we are working toward a one-day session. I think Dr. Morrison has been in touch with the legislature. I don't know if she needs to give final approval of that, but as I said here before, the clerk has designed the legislature current sitting area where we could socially distance and physically distance and have a session using plexiglass and some other things that would need to be there. And so our plan right now, subject to another meeting, is working toward a May 22nd one-day sitting.
Hi. Yes, sorry, my phone started ringing. I didn't mean to, assuming we all know what that does. So I take that back. So my next question that would be for Dr. Morrison. When it comes to mental health support, When will Islanders be able to resume face-to-face appointments? I'm sorry, this phone's a bit crackly, so I'm not sure if you can hear me properly, but face-to-face appointments with their therapist, psychologist, psychiatrist. I understand that some are doing face-to-face appointments now, but that perhaps some that work out of the hospital aren't able to see their clients face-to-face. So I'm just wondering if you can clarify that as far as the phases and where that kind of fits in.
Well, I mean, I think I'm going to redirect the question to Marian because it's a health PI service, and I know some of those public kind of psychologists, et cetera, would be certainly actually practicing with physical distancing already, but I think as part of phase 1. But I'll let Marian answer specifically about the health PI mental health supports.
Yeah, thanks. Hi, Louise. It's part of our overall planning, and we really have to think about the physical environment of the location of where those interactions would take place, and so for the safety of the client as well as the provider in any of these cases. So traffic flow coming in and out. How do we plan for those kinds of things to happen with respect of all the other services happening? So it is part of our phased approach. Some of the services may continue in virtual state for a period of time, but I think some of them will start happening a little bit more in person and face-to-face as well. So it's really part of our phased approach as we look at everything, and from the hospital-based perspective, even thinking about blood collection and draws, that's traffic and individuals coming through entrances to our facilities. So that's why it's going to take us a bit of time to ramp some of those services up and make sure we have appropriate plans in place.
Thank you very much to you, all of you. Thanks.
Thanks.
Rachel Collier, Eastern Graphic. Hello. My question is for Dr. Morrison. And it's all protocols, measures, and factors considered. Is there any way you can define the level of risk an island hairstylist seeing maybe 20 people a day interacting face-to-face with these clients with non-medical grade masks, trimming bangs, shampooing hair will be facing throughout phase 2? Assuming not much changes between now and May 22nd, do you feel you could say there's no risk or low risk, or basically are you able to offer a straightforward definition of the risk hairdressers will be facing should they go back to work May 22nd? So this.
Hi, and I know you've had other questions in the same industry focus, I think on Monday as well. And so speaking about risk is always a challenge, and communicating risk is always a challenge. But we have to look at frequency, and also it's when we have operational plans being put in place, and we've said clearly operational plans need to be in place to try to minimize risk. And that is why we need to have those in place. And part of those operational plans are what are places doing to look at traffic, how people are being screened, how they are able to physically distance from each other. For instance, if there's more than one person in a salon, a hairstylist, are they using every second seat and not every seat? Are they staggering shifts of when people work and when people can come in? What is the enhanced cleaning? What's the enhanced hand washing? Are you screening the employees? Are you screening the people who are coming in for illness? And so that would be similar to other places. We look at the frequency of how people would go to a location. People who go to other kinds of retail places, what they do there, and we've said right along, if there's not an operational plan that can minimize that. We would not want people to open. We also are in a different place than some. We do not have any evidence of widespread community transmission. We're testing. We have, I'm not sure I even mentioned it today, but 227 more negative tests since I last spoke. And you look at what is happening. Manitoba already has included hairstylists opening May the 4th, and Saskatchewan, May 19th. Indications from a number of the other provinces that they will also be going middle to end of May. The other part of it is that the risk, the measures that need to be put in place for an operational plan to minimize risk are the same in Phase 2 as they would be for that industry in Phase 3. There's the same important measures are going to be put in place. But I certainly recognize there's concern, and there will be concern also amongst people who may choose not to go to certain retail places, who may choose not to go because they are concerned as well. But we are certainly, and I support those who would not go back at the end of May, and they want to wait till the end or middle of June, or whenever they feel comfortable. We are trying to balance that risk with what is going on in the province, but there's also not as many people are emailing to say they really do want to go back to work, but there are also some who say, we think we can do this safely, and we want to get back to work.
Okay, and I guess hairdressers have started a petition which now has, over 1,400 signatures, and they're asking to delay permitting hairdressers to go back to work till at least Phase 3. And I'm just wondering, maybe Mr. King could answer this as well, I'm not sure, but what responsibility do you feel the province should take here to limit competitive pressure hairdressers are feeling to go back to work, possibly before they feel confident it is actually safe to do so?
Well, I would mirror what Dr. Morrison had just said. I think that judging by the daily correspondence that I get, there are lots of people on both sides of this particular discussion, as there are on many sides of many different discussions that we're having here as a province. And I would again say that although we seem to have taken this for granted, these are great and wonderful discussions for us to be having as a province. The fact that we're discussing whether we should go back now or later, when in other jurisdictions across the country and around the world, the conversations are drastically different and serious, more serious. So, look, I would say that, as Dr. Morrison has said, I think that there's never a perfect time here. I don't think. For some, we can't move fast enough, and for others, we can't go slow enough. And we're trying to find that. Fine line that we're trying to walk. At the end of the day, each individual will make a decision if they don't feel safe or don't want to open on that date on the 22nd. We're not running around and dragging people out of their homes, making them go to work. I think there will be lots, as Dr. Morrison says, there'll be lots of people such as me who will be eager to get out to get a haircut, and there will be others who will be wanting to wait a little bit longer. So I think our responsibility here is to put the guidelines in place that we feel are based on good health measures, on good science, and are mirroring what they're doing in other jurisdictions. But when the chips come down and when the decisions are made, individuals will have to make those decisions for themselves.
Thanks so much.
Thank you.
Stu Neebe, The Guardian.
Hi, good afternoon. Question to Premier King. Just going on, I guess, some of the statements from the official opposition. I mean, but really about 2 weeks now, I think they've been sort of suggesting that the legislature be recalled. I mean, given that we're one of the last provinces that hasn't really had a legislative session, and Ottawa has really managed to sort of figure out how to do a virtual parliament. Really, why can't we actually have sort of more than a one-day emergency spring session, to provide some oversight and accountability to the COVID recovery effort?
Thanks for the question, Stu. And I guess I haven't been paying close enough attention to the couple of week onslaught, as you call it, I have been working with the leader of the opposition, working toward, and the leader of the third party, working toward having a session. Which would have a one-day session to deal with the emergency sessions we need to have, and to work in June to have a full session. So I'm not understanding the inconsistency of the opposition message. I mean, on the calls Monday and Friday, we are working, the leader of the opposition, the leader of the third party, and I, with the speaker, with the clerk of the Legislative Assembly, to actually have a session. So I'm at a loss as to understand why the positions are changed.
Okay, and just so for clarification, what seems to be suggested is a one-day emergency session, and then sort of further days for sitting, maybe in June, I guess, of the legislature?
Well, yes, thanks again, Stu. I think obviously a big part of governing in any province in a democracy such as ours is having a session of the Legislative Assembly, or whatever the equivalent is in each province, to make sure that questions can be asked, that we can work on legislation jointly, and to get things done for the people that you serve. We are anxious to do that. I'm not sure why there's some kind of suggestion that government doesn't want to go into the legislature. A big part of what we need to do is to go to the legislature, and we're working on that. We are in the middle of a pretty significant worldwide health pandemic that requires our attention and to be directed accordingly. In the process of doing that, we're consulting every day with the other opposition parties. Everything we're doing is in plain sight. We've asked the auditor to review, and we're anxious to get in the legislature. And as I say, we have been working with the leader of the opposition. I'm assuming both, I know when on the table, on the call, I'm representing the will and desire of my caucus, and I'm operating under the assumption that both the leader of the third party and the leader of the opposition are doing so as well.
Okay, thank you.
Thank you.
Carrie Wynn McLeod, Ocean 100.
Good afternoon to all. My first question, I guess, I'm just looking for some clarification from the Premier. When you mentioned that tomorrow you're hopefully going to, in conjunction with Ottawa, have an announcement from the federal government regarding low-income workers, is that meant to be for the sort of pandemic pay for the frontline healthcare workers? Is that what you're talking about?
So the federal government a few weeks ago announced a low-income support for essential workers. I think it was initially, when it was initially announced, it was announced primarily for healthcare, but as we discussed across the board, many people in the health industry were probably above the level. Certainly in PEI, there's about 18% who are below the level, and they will be part of this program. But it has evolved over the last little while to be a fund available for low-income workers in the essential workforce. And the amount of money for PEI is about, I think it's $16.7 million is what the amount of money here for PEI is. And we were asked by Ottawa to submit, which I think is really indicative of the good positive relations that we have between the province and the federal government. All of us across the province have been asking the federal government to allow us to help them distribute this money to where it needs to go. So we've put forward a plan that we expect will be signed off later today, which is designed to put some money into the hands of those low-income workers in the essential workforce.
Oh, thanks for clarifying that. My other question, Premier, of course, we have heard a lot from the Hairdressers Association, but in conjunction with any other industries out there, where workers feel that they just aren't comfortable going back to work because of safety issues, do you know what that would do or affect when it comes to their, for instance, their Canadian Emergency Response Benefit or their EI, if they say that they just aren't comfortable in going back to work? Is there a fallout from that if they decide to do so?
That's a good question, Carrie Wynn. Look, the CERB is a national program, of course. That is an emergency response benefit. So I don't imagine anybody would lose their emergency funding, opting not to do so now on safety, precautionary measures. It's something they probably should ask the federal government to get final clarification on. And I think the same response would be to EI. I think that there's a certain amount of flexibility here that we all need, that we're all operating under. But those two programs that you outline are federally run and totally federally funded. So I think the question would need to be asked to somebody at the federal government. But I would certainly hope, and I would be lobbying hard for those to make sure they don't lose any of those benefit if they choose to take a little bit longer to go back to work dealing with the worldwide health pandemic that we are.
Super, thanks.
Julien Lecacheur, Radio-Canada.
Hi, everyone. First question will be for you, Premier. Premier, the 21st of April, you said that if the number of cases of COVID-19 is low in PI and in New Brunswick, there will be maybe a possibility later this summer to reopen the bridge between the both provinces. And you also said that you will discuss about this possibility with the Premier of New Brunswick. Premier, I would like to know where are you right now with this position? Do you think that is it possible to open a bubble between PEI and New Brunswick later this summer?
Look, I remain very hopeful of that, and I think what I said then and what I continue to say is that providing we're in a situation where the Public Health Office in Prince Edward Island and their counterparts in New Brunswick were comfortable to exploring that I think it's something that would be a more possible eventuality than some other interprovince travel at the beginning, for sure. I think we're still a long way from that. I mean, Dr. Morrison would reiterate, I ask her this often. This is a question I do ask often, and that is probably my interest to try to reinvigorate the economy a little bit more robustly than what we currently are dealing with. But obviously, our plan, Renew PEI Together, is based on keeping people safe and healthy. And so I wouldn't say we're in a position today to announce any time soon, but it remains a hope of mine. And I know my counterpart, Premier Higgs, talked about certainly not looking at anything before July 1st, but it's on his radar as well. But we have to make sure we can do it safely, and Dr. Morrison and her counterpart in New Brunswick will play a big role in that before we can get there.
Thank you, Premier, on this. Just a follow-up for you, Dr. Morrison, in French, so I will switch to English to French. Dr. Morrison, si jamais une bulle était créée entre l'île du Prince-Édouard et le Nouveau-Brunswick, quels seraient les tests possibles qui seraient faits aux résidents du Nouveau-Brunswick qui décideraient de venir à l'île du Prince-Édouard pour visiter ou passer du temps à l'île du Prince-Édouard? Est-ce que vous avez déjà des idées en tête? Est-ce que vous avez déjà parlé de ces possibilités avec vos homologues du Nouveau-Brunswick?
Bonjour Julien. En général, on regarde le nombre de cas, les choses comme ça dans les deux provinces, et s'ils sont confortables, et dans le processus de changer les phases ici à l'île du Prince-Édouard et au Nouveau-Brunswick, qu'est-ce qui arrive. Mais les détails de qu'est-ce qu'on fait pour auto-isoler, de les suivre ou faire tester, on n'a pas discuté ces détails. Alors, on est en train de penser comment ça va marcher si on est là un jour, mais on n'est pas là encore.
Merci.
OK, merci.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you all. I'll ask my question in English if Premier King wants to chime in. Madame Dr. Morrison, si vous pouvez répondre en français aussi, ce serait apprécié. So the question would be about the businesses that will reopen in phase 2. Will there be a way for the customers, the island customers, to know if a business is compliant with all the public health restrictions that will be in place, like social distancing? I'm thinking of something like the restaurant inspections. The customers get to know if the restaurant has failed or if it's compliant with the public health measures. So is there anything like that planned to make sure that customers know beforehand, before they go to a business, whether that business has been compliant or not with the measures that will be in place?
Francois, maybe I'll start to answer your question first in English. So the answer is yes. If there's been a complaint and on a follow-up or an inspection and a facility doesn't have an operational plan, or there are concerns similar to restaurants that will be posted. We're working out some of the details of what that could look like, but that is certainly part of our thinking going forward, and it's why we are making it clear and trying to be clear that we're having guidance available, but that each business would need to have an operational plan in place. We'll be doing some inspections going around to different places, but also we'll be doing it on a complaint basis, but those will be made public. It would be my thinking at this point in time, and from our discussion in the office, it would be similar to that restaurant inspection availability. Again, appreciating that this is all new for our officers as well, but we're working through those details. Alors, en français, oui, on fait des plans au moment que s'ils font des inspections, il doit avoir un plan d'opération. Et puis, si on reçoit un complaint de quelqu'un, on va les inspecter. Et s'ils ont des choses, ils ne sont pas un plan d'opération, on va le mettre sur un site web. Pour que les gens peuvent les voir. Mais on est en train de faire les détails autour de ça.
Merci beaucoup. Next question for Premier King, if I may. Do we have a figure of how much has been spent or at least put on the table to help with the COVID recovery? All the announcements that were made by the province, has there been an add-up of that to know how much the province is actually spending in all forms of support for islanders?
Yeah, I think we've been talking a lot about our business and our response, and we're in the $50 million range is what we have earmarked around for that. We've had a lot of expenses that we've incurred around the increased purchases of PPE and the increased costs that come with providing services required for COVID. So I think I haven't talked this week to the Minister of Finance directly, but I think that all in, we're probably looking at close to $70 or $75 million is what the cost has been so far for the impact of COVID on Prince Edward Island.
Thank you.
Merci.
Laurent Rigaud, La Voix acadienne.
Good afternoon. I have a question for Marian Dowling. I just wanted to know if you noticed a decrease in the number of people going to the cough and fever clinics. I mean, with the spring now and the fact that we are isolated from the other provinces, is it expected that less and less people will come to be tested?
Hi. We did see a decrease last week in our numbers coming to the clinic, but those clinics and screening sites are there as well to match with the expanded testing, which is now happening across different sectors of individuals on PEI. So we're back up to sort of where we were the week prior now this week. I think with spring coming, we hope people have less runny nose, cough, fever, those types of things. However, we're continuing to support the surveillance efforts of the Chief Public Health Office among the overall population, as well as our surveillance and screening of some of those individuals, which Dr. Morrison mentioned today, like staff working among multiple care homes and those types of things, if they're happening going forward, or some of our providers who do travel out of province for their work and then come back and work in PEI. So and those other essential workers. So those services will remain in place to support the surveillance efforts overall of the population base with the public health measures. But we did see a little dip last week. This week we're right back up with the expanded testing criteria, which are quite broad now to help support the safe reintroduction of services and opening up of some of these things.
Yes, but so just to be sure, except the extended testing, the numbers are going a little bit down.
Yes, I would say generally from the public going down, that has dropped a little bit. It's probably equal to last week, and our numbers that have increased up again this week are related to those expanded screening guidelines.
Thank you.
You're welcome.
I believe that's it. So thank you very much to our friends in the media for their questions and for keeping Islanders informed, and we'll chat again later. Thanks.